should we morally think about the access to health care? Well, bioethicists have talked about different reasons why health care in particular might be something that inside of a community might be on the lists of things that you have some entitlement to. And different interpretations will give us sort of differently ambitious versions of what membership gives you as an entitlement. So one very important one gives us a sort of floor of entitlements, that at the very least you should be entitled to health care needed to avoid extreme deprivation, right? A right to what's called a decent minimum. The reason, again, simply, you can't really function as a member in that community if you don't have access to certain fundamental, again, a floor of, if you don't have any food to eat, if you're dying of childhood cancer and have no access to care, if you have no access to literacy programs, these are all things that will preclude you from even being able to participate as a member in the community in any meaningful way. Well, here's a more ambitious one that some bioethicists have argued for, that there may be not just a right to a basic minimum, right, that lets you into the door of participation, but maybe a right of equal opportunity to what are called the fundamental goods of membership. Things like political voice and employment, okay? That more than just wanting to make sure that nobody falls below a floor, that nobody exists in extreme deprivation, even if we're all above that, if we have too much of a gap between haves and have-nots on the basic goods, and not on how much caviar you have, okay? But on basic goods, we might worry about that because it means that where you fall in what's called the natural lottery and the social lottery have an outsized effect on your trajectory, and here's what I mean. So what do we mean by the natural lottery? This is the idea bioethicists talk about of what you biologically were given at birth, just by happenstance. You didn't earn it, you don't get credit for it, you don't get faulted for it, and some of us luck out more than others do in the natural lottery. If you have a disposition to diabetes as a child, right, and another person doesn't, the first person is less lucky in the natural lottery. Okay, then add on the social lottery, things like what family are you born into? What kind of wealth do they bring to you? What kind of society do you live in? Okay, and bad luck in the social lottery can really magnify bad luck in the natural lottery. So here the argument is, this is the argument from equal opportunity, that social institutions, again, when we're building a community get-together, that part of their jobs is to do some smoothing out of the effects of those two lotteries, so that a child born to one family and a child born to another have at least rough equal opportunities to the basic goods, right? Not that their lives will end up exactly the same, right? Things like how hard they try might have an important difference. What they value, one might value having a high income, the other wants to really take it easy and live off the woods. Fine, but they both had the same opportunity to pursue things. Notice that the second basis of justice will have a more ambitious claim that societies have to give. Not enough just to reach above deprivation, but how are we doing relative to one another in terms of opportunities? Okay, here's a third one that bioethicists have talked about, a third basis for justice for access to health care that's actually specific to the nature of medicine itself, as opposed to food and education. It's kind of a cool argument, and it goes like this. Knowledge is a public good. But medical knowledge is kind of interestingly special. For one thing, practicing with medical knowledge brings a lot of risks with it, right? Because however much doctors and nurses will communicate effectively, there's going to be an irreducible gap. There's going to be an asymmetry of understanding that we can't eradicate no matter how good our little pictures get explaining the risks, okay? And especially because that gap, that asymmetry in knowledge can exist when you're very vulnerable, like, oh, it's life and death, I don't have time to get a medical degree, right? We actually place restrictions on who gets to use medical knowledge to practice. We have licensure. In essence, allowing certain practitioners a monopoly. They become gatekeepers to the benefit of that medical knowledge, okay? Well, what happens when we have monopolies? If we allow them, which in this case we should, we have public reason to do it, we could ask more of the people who practice them. So part of what we might ask is that you have to have some public commitment in the use of this knowledge and not just use it for personal gain. Or again, think of medical research, massive public infusion of dollars into medical research. The NIH alone, National Institutes of Health here in the United States, billions of dollars, okay? Think of what it would mean to say that the society and everybody who contributes their taxes and their resources and their efforts puts into the pot of medical research, but only those who can afford health care or who have a job get to benefit from that medical knowledge by accessing the provisions. Doesn't seem fair. So very different views about justice and access to health care, with some different implications for how much you might have entitlement to. Here's the last thing that we want to note about justice and access. No matter what your foundational basis for thinking that people might have a right of access, you're going to face tough choices. Because no matter what, no matter how ambitious your justice view is, we've got scarce and finite resources, and health is one of those things that may not have a limit, right? Might even be unlike food, where at some point too much food is actually bad and unpleasant. Not such a thing as too much health, right? So medicine, as an area, doesn't come with self-instituted boundaries. We have to decide them. When do we want to spend the dollar not on health care, but move it over to more education, or just letting people have fun with their caviar? Okay. So deciding how to spend the healthcare resources is always going to be something that's tough, and itself is an issue of justice. Do we spend the money on the least well-off? Do we spend the money on those who would have the most years left in front of them? Okay. How do we prioritize? Well, I want now to turn to a different example where justice in bioethics is absolutely foundational. And this is the topic of climate change. It is the moral issue of our generation. So let's just take Bangladesh, one of the poorest countries in the world. Even if we keep to 2 degrees centigrade, we're looking at something like 40% of the country being underwater. 100 million climate refugees. Indeed, the United Nations estimates that by 2050, 1 billion people will be displaced by climate change and environmental degradation. Now, I said that this is an issue of justice. Why did I say that? Because so far from this description, what we could be describing is, a massive humanitarian crisis, like we think about with armed conflicts, right? That there's something dreadful happening, and we're asked to help. We're asked to chip in. We're asked for beneficence or charity. But there is a different principle at issue, the principle of justice, that says it may be that those countries that have contributed so much historically to emissions, right, even if they do a really good job, which we hope we will, okay, find that political will to massively reduce our emissions, might still have an obligation of justice to help foot that accommodation bill. And here's why. The atmosphere is a common good. Common good means it doesn't belong to anybody in particular at all. When I emit greenhouse gases, it dissipates uniformly in the atmosphere. I can't just pollute my own little bit of atmosphere, right? So we can't just say, here's yours that you can degrade as much as you want and then deal with the consequences. We can't limit it that way, right? It is the commons. It's a finite resource. That's what we've discovered. We used to think it was infinite. We could keep putting greenhouse gases and other emissions up there and it would just absorb it. We didn't know. Now we know it's finite. The atmosphere can absorb about 1 trillion tons, all told, of carbon before really, really, really horrible things happen. So in essence, the countries that were lucky enough to develop early and fast and got lots of benefits from it, right? We established great institutions, right? A rich country, good educational system, made it easier for democracy to flourish when you've got some baseline of economic affluence. But it turns out we used up more than our share. I say we, developed countries and especially the United States. We used more than our fair share of it, judged either internationally or in terms of future generations. And again, we have accrued benefits from it, right? Those benefits leave us with an ability to now say, not just as a matter of charity, but wow, we used more than our fair share. Maybe not even negligently, because maybe we didn't know, but it is true. We get to pass on to our children the accrued benefits of everything we did, and therefore we have to contribute proportionately to helping to mitigate the harm that the rest of the world, along with us, will face. Now, I have to say one more thing. Whenever I talk to people about climate change, we have to face up with a certain fact, which is it's hard to talk about hard news, right? And one of the things that I think is so important, and part of why I've been at pains to say, we didn't necessarily know, right? Whenever I teach bioethics, I always teach my students the concept of cognitive dissonance. Okay? Cognitive dissonance is a powerful common human psychological condition that says when we are presented with evidence that represents us as worse people than we thought, it raises dissonance in us. And part of what we can subconsciously do is push the evidence away. Okay? Alternatively, we listen to the evidence, but then we get so fatalistic and cynical that we do nothing except complain. Okay? Both of those are disastrous things for humans, but that's how we're wired to be. So one of the most important takeaways on climate change is not focusing on what terrible things we've done and how bad we've been, but how incredibly empowered we are at the individual level, at the national level, at the international level, at the social media level, right? To start talking about how could we be moral leaders here? How could we take our dollars, for instance, and invest them in solutions to this? So Gandhi has this great, beautiful quote, "Be the change you want to see." Well, what if we also added, put your money, invest as individuals, as communities, into the change you want to see. Start building the green economy by jump-starting it with angel investment funds. Right? So the lesson there is so much we can do. Okay? And resist the human tendency to think either your guilt has got you down so far, that's my generation, your generation didn't do it, okay? Or that the political discussions are so difficult that there's nothing you can do, right? Because there's an amazing amount we can do if we do it together. Thank you.